top DLP challenges for hospitals, insurance carriers, and claims processing agencies. The top source of data leaks is, of course, user error, and that's constant through almost every industry. Now, that includes things like shadow IT, which is the transmission of data to a third party for whatever purpose. Most of the time, it's the user just trying to do their job. In other instances, it is an insider threat, an insider trying to steal data. And that usually happens over a third-party email like Gmail or Yahoo Mail or whatever flavor you're using. And then it can also come as personal file storage like Dropbox or SkyDrive or Google Drive to hold that PHI. The other thing is users can be phished or tricked into divulging their credentials, their username and password, or actually just giving up, large chunks of information. The second biggest problem, and this may come as a little bit of a shock to the hospitals, or it may not, it's actually the doctors. The doctors are the second biggest problem. First, it's the users, then it's the doctors. The doctors have a lot of leeway in a hospital because, of course, if they don't like your hospital, they can go get a job anywhere else. Hospitals are kind of hurting for doctors. A hospital without doctors isn't much of a hospital. So we have to treat them well. A lot of times they're unrestricted, meaning they can just surf the web and go where they want, mostly for research purposes, right? We wouldn't want to restrict a doctor from looking up a term that somebody, they're describing their illness and they're using a term, the doctor would have to look that up. So we see a lot of that and a lot of weird things come out of that for another discussion. The other thing with doctors is they oftentimes have a private practice. That means they have a doctor's office outside of the hospital, and a lot of times they're shared patients. One good example of this is if you have a patient now and that patient gets hurt and has to go to the emergency room at the hospital, those records are going to transfer. And a lot of times those records transfer through things like Gmail. They don't often, sometimes they don't take the right path to get where they're supposed to be. The other thing with doctors is the private practice itself. There'll be a laptop or a tablet with medical records that is, goes between hospital and private practice, which can be a violation if it's not handled correctly. The third thing that is tripping up these hospitals, insurance carriers, and claims processing agencies is HIPAA and the way it's written. It's written in a way where it doesn't get real specific with its requirements. That's to prevent the HIPAA regulations from shutting businesses down, but enhancing their security, so to speak. So it puts a loosely written framework in place to describe the data and how you should protect it and how you're liable. So that basically causes every outbound email at a hospital to cause a HIPAA violation in a DLP product. The basics of HIPAA is basically a name and a disease equals PII, which means if you have an email signature for, say, a cancer clinic, and your signature goes out and it says underneath cancer clinic or diabetes clinic or whatever the clinic is where you work in that hospital, that's going to become HIPAA violation because your name is right next to it. And it doesn't, the DLP systems don't necessarily know in a lot of cases what the diagnosis of each individual is to go, oh, that's a valid diagnosis and call it that. It just sees a name next to some sort of diagnosis or disease, which creates a HIPAA violation. So getting through that becomes a challenge, and it makes real security anomalies harder to detect because they should be anomalies in your environment that are, hopefully easy to spot. But that becomes difficult if you have 10,000 alerts in a console finding, what's really important. The next source of data leaks with health insurance or health information is data exchanges. So the ways in which hospitals, insurance carriers, and claims processing, the way they communicate. And this kind of falls in line a little bit with the user error and new technology adoption. This is actually the business technology adoption. Um, and so it becomes a rapid source of of misconfiguration sometimes. So those things need to be checked. The security on those APIs and those apps need to be checked. But your DLP solution isn't really worth much if you come in the morning and there's 10,000 events for you to sift through, and it takes you 3 days to get through them because every morning there's a new batch of 10,000 or whatever it is. So the idea with DLP is to implement it and tune it in a manner which can make it better and more efficient and more accurate, reducing the false positives. On dataleaktest.com, there's some information that will help you do that. And there's also everything you need to test to make sure that your systems work. To go through if you're a hospital, if you have medical records that are an image format, I'll show you how to navigate that and test to make sure that your DLP solution is picking up optical images of PHI or things like x-rays and with a diagnosis or a patient name on it. You should be able to catch all that. Same thing for claims processing and insurance carriers. You're going to harbor that stuff, so you have to take care of it appropriately. So that's a very broad overview of the challenges, the DLP challenges for hospitals, insurance carriers, and claims processing agencies. Be sure to check out our other videos, which will help you walk through and tune for HIPAA and other types of compliance mandates on our site. Thanks for watching.